Okay, hello again. This week, as discussed, we'll be coding injuries and poisonings. And again, these codes start with the letter S00 and go all the way through T34. And some of these conditions that we'll be coding here include such things as open wounds, fractures, dislocations, sprains, injury of nerves, injury of blood vessels, crushings, traumatic amputation, and others. Blocks T20 through T32 classify burns and corrosions. And at the beginning of chapter 19 is a note to use secondary codes from chapter 20, external causes of morbidity, to indicate the cause of injuries. And these codes that fall within the T section of ICD-10-CM chapter 19 do not require an external cause, as the external cause is already included in the code. ICD-10-CM contains a note under the different categories of open wounds to direct the coder to code any associated wound infection. Here is a key point that I want you to pay attention to, and it's this. Like we saw earlier, we have an initial encounter, a subsequent encounter, and a sequela. With this, it's very important to get your head around the fact that if we have A, D, and S as a seventh character, it has to go in the seventh place. That means that if the rest of the code doesn't have 6 characters, you need to use X's as the placeholder to make sure that that A, D, or S goes in the 7th character. Like we've talked about, fraction extensions are unique because they have additional characters besides the A, D, and S. There are a lot of chapter-specific guidelines for this that talks about the application of these 7th characters. Note that they're all 7th characters. These guidelines cover not only the 7th characters, but how we code injuries, such as superficial injuries, initial versus subsequent encounter for fractures, multiple fractures, and physeal fracture types. Burns are another complicated area. They're chapter-specific guidelines of ICD-10 that talk about coding burns, corrosions, the sequencing of the burns, and the related conditions, burns of the same site, non-healing burns, infected burns, and other areas. Please give these guidelines your utmost attention. With injuries, there's 2 alphabetic letters that cover these things. The S section provides codes for the various types of injuries that are related to a single body system. In other words, S for single body. T covers injuries to an unspecified body region, as well as poisonings and other certain consequences of external codes. It may be helpful to look at it this way. The S is for a single body system. A poisoning, which affects everything systematically, is the T code, along with the adverse effects, because these types of insults or injuries to the body, if you will, aren't confined to a certain body or system or anatomical region, if that makes sense. Some entry codes have less than 7 characters in length. And again, as noted, we use the 7th character X to fill the position to allow the addition of the 7th character to be in that 7th spot. So as we see here with SO1, 5.01XA, initial encounter for care of a laceration without foreign body of the scalp, the 6 holder has to be the placeholder X. Why? So that A goes in the 7th position. And again, the 7th character A for initial encounter is used while the patient's receiving active treatment for the injury. This includes such things as the emergency room, the subsequent admission, the initial surgery that's part of the same patient care episode. The 7th character D for subsequent encounter is used for the encounters after the patient has received active treatment for the injury and is receiving routine care for the injury during the healing and recovery. The S for sequela is used for complications or any condition that arises as a direct result of the injury. One thing about ICD-10 as opposed to ICD-9 is the fracture codes are much more specific. In addition to the type of fracture, we get the specific anatomical site. We also get whether the fracture is displaced or not, along with laterality, meaning left or right, routine versus delayed healing, non-unions, and malunions. And again, most people are familiar with what a closed fracture is versus an open fracture. Displaced fractures are a break in 2 or more parts and the ends of the bone need to be aligned. A non-displaced fracture is a crack in the bone, but the bone remains in alignment. Please check your textbook and specifically look at figures 22A1, 22A2, and 22A3 for further explanation. Other terms that you may want to be familiarizing yourself with include comminuted fracture, green stick fracture, impacted fracture, oblique, pathologic fracture, stress fracture, transverse fracture, malunion fracture, and non-union fracture. And again, we have the 7th characters in addition to A, D, and S. We also have B for initial encounter for an open fracture, G, subsequent encounter for fracture with delayed healing, K, subsequent encounter for fracture with non-union, P, subsequent encounter for fracture with malunion, and S for sequela. Thankfully, all of these are articulated in the tabular.